And okay, got it. So my name is Natasha, and I am the Community Engagement Manager for the New York Charter Schools Association. Before we start, let's have our interpreter provide instructions for our Spanish translation. So Evelyn, would you like to explain to everyone in Spanish how to join us?
Bienvenidos todos. Mi nombre es Evelyn, voy a ser la intérprete para este foro del día de hoy. Entonces, todo lo que necesitan traducción en español, hagan clic en el globo traqueo en la parte inferior de la pantalla. Este le va a colocar en una sesión de audio conmigo, pero seguirán en la misma sesión de video con los demás. Si tiene alguna pregunta que le gustaría hacer a los panelistas, colóquela en la área de las preguntas y respuestas, no en el chat, que será monitoreada durante el seminario web y intentaremos que se respondan todas las preguntas. A lo largo de la sesión colocaremos enlaces de recursos en el chat.
Now I'm going to put what she just said in the chat. And now I'm going to click on the globe now, and we're going to start the interpretation. Are you good, Evelyn? Bueno? We good? Okay, we got the thumbs up. So the Spanish interpretation has started, and Dr. Easterling has joined us. Hi, Dr. Easterling. We don't see you on the screen yet, but we see that you're here with us. So thank you for joining us as well. So thank you to everyone for being here tonight. All of our elected official, our healthcare and professionals. We're here tonight to learn more about the vaccination. And now that it's approved by the CDC and the FDA, as of October 29th, for youth ages 5 to 11, we want to bring this event to you and this opportunity to you to ask questions and have just a forum so that we can just really be of service to you in regards to this vaccination. So this event is brought to you by the New York Charter Schools Association, the Coalition of Community Charter Schools, Democracy Prep, Achievement First, Uncommon Schools, and KIPP. I want us to have as much time with our experts and time for Q&A, so let's get started. During the forum, if you have any questions, please put them in the Q&A portion of the Zoom. So if you look at the bottom, you'll see a section that says Q&A. Please don't put your questions in the chat. Put them in the Q&A, please. And throughout the session, we'll also be adding resource links, and we will do our best to answer as many questions as possible. Please note also, as we go through this and you hear from experts, you should always, always, always check with your physician before you make any decisions about yourself and your family in regards to your health care. They know your medical history, they have your records, and together you can make the best decision for your family, for yourself, for your children. So with that, I'm going to turn it over and also remind you that this is going to be, this is being translated. So Mariella, for anybody that came on, could you please tell them what to do, please?
Yes, good evening, everyone. So para los que hablan en español, he visto en el chat que tienen unos problemas. En el menú de la pantalla de Zoom hay un globito que dice interpretación. Si hacen clic en ese globito, hay la opción de poner Spanish. Cuando presionen ese botón, entonces van a poder escuchar la traductora.
Okay, so next up is Jackie. Take it away.
Good evening, everyone. My name is Jacqueline Martell, and I serve as the Director of Advocacy for Achievement First. I see a lot of people putting in their schools in the chat. I'm excited to see folks from all across the city and the state of New York here tonight for an informative webinar. If you want, feel free to throw your school name in the chat so we know who's here, and keep on doing that throughout the night. We're going to start first, and I'm going to have the pleasure of introducing Assemblywoman Stephanie Zinnerman, who represents the 56th Assembly District of Crown Heights and Bed-Stuy. Before I turn it over to you, Assemblywoman Zinnerman, we're so grateful for you to be here, and thank you so much for your continued advocacy, both downstate in Brooklyn and the city at large, as well as throughout New York. I'm going to turn it over to you and open the floor just for you to share with us the importance of vaccinations for your respective districts, but the community at large, and why vaccinations are particularly important for children.
Well, good evening to everyone. And thank you to the New York Charter Schools Association for always being on the pulse of what's important in our community. I don't know how many Zooms I've participated with you over the years, but I really am grateful for your advocacy and making sure that your parents and your students stay informed. But I've had the pleasure of interacting with them as well. And they know what's happening in their community. They understand that they have a voice, and more importantly, that they have a responsibility to community. And we are a community of residents of not only my district, but of Brooklyn and New York State. And our role really is to keep each other safe. And safety comes in all shapes and sizes, but for the purposes of this community, this conversation, we're talking about our health and safety, our health and wellness. And I've been involved with a number of initiatives, from age-friendly to ensuring that, preschoolers, well, no, let's go further than that. Newborns to the elderly have the best chance at a quality life. And certainly the topic of COVID-19 and vaccinations fit into the conversation. And so we all know where we are at this particular point. We have, as a state, tried our best to ensure that as many people who could receive the vaccination does and has. But despite our best efforts, we are still having and seeing an uptick in our cases. So I think that this time and this period is a time of reflection where we all kind of look at our own personal choices and understand that while we are all concerned about ourselves and our relatives and our families, we have a public responsibility when we're in the public sphere. If we were all staying at home, we could do what we wanted to do. But as soon as we kind of walk out in public and we are sharing space, we have to think about community and more than ourselves. And basically, that is what the policy is based on. Our ability as a state and as individuals to keep our neighbors and our families safe. So Dr. Easterlin, who I've been in company with for a very long time, will go into the medical facts about the vaccine. But we know, whether we were talking about measles or rubella or chickenpox or the flu, vaccine, that vaccines work, and they have a particular purpose that is aimed at public health. And so we really just want to underscore that issue for people, and really ask their cooperation, and really step away from social media and the noise that other people are amplifying around all the things that are wrong or that they think are wrong, and really look at the facts of the matter. So many of us are living, breathing examples that the vaccine works. I myself took the J&J, which was the one that everybody was scared of. So I like to tell people that I'm J&J positive and still living and breathing, and didn't have any effects. And I think it's up to each and every one of us to share our stories. It is how we impact, public opinion, where people can kind of trust the fact that their neighbors, their friends, their family members have been vaccinated and are still here to tell the story. And the story, again, is we keep each other safe. It is our responsibility to make sure that we are protected, and the vaccine is the way and the science that we have to protect us against the COVID-19 vaccine. So I am looking forward to working with you all to continue to amplify that particular message. And if we need to have more forums like this every week, count me in. Sometimes I might have to leave a recorded message to make that happen, but I think it's very important that we just keep talking to people and sharing the success of the vaccine, because by all measures, this has been a successful endeavor, because I really would shudder to think if we did not have it, where we would be given how we started 18 months ago with this pandemic.
Thank you so much, Assemblywoman Zimmerman. I know that you'll be staying on for Q&A later, but we thank you so much for being here. I'm going to turn it over to my colleague at Democracy Prep, Ms. Princess Lyles.
Thank you, Jackie. Thank you again, Assemblywoman Zimmerman. We appreciate you being here and appreciate your words. Hello, everyone. My name is Princess Lyles. I'm the Vice President of External Affairs at Democracy Prep. Next, we're going to hear from Dr. Torian Easterling, who is the first Deputy Commissioner and Chief Equity Officer at the New York Department of Health and Mental Hygiene. He's the doctor we see in commercials every day, sharing the importance of the vaccinations. So I'm sure he has a lot of information to share with us. Dr. Easterling, can you just take 5 minutes to reiterate the importance of children being vaccinated, even if they've had COVID before, and define the option available for vaccinations for children in this age group of 5 to 11 and how it works a little bit?
Absolutely. Thank you so much, Princess, for the introduction. Assemblymember Zimmerman, always great to see you. Thank you for all of your leadership and the work. We've been side by side virtually, of course, really getting the message out. And as the groups around eligibility has expanded, really it's been so important to just share the message and make it really clear about who's eligible, why this is important. And so these spaces that we are curating and nurturing so we can have these type of conversations remain critically important. And I did see one question come up in the chat about the urgency that we're in right now. I mean, the fact of the matter is we are not out of this public health emergency. We're still very much in this pandemic. And unfortunately, we are seeing a resurgence of cases. And over the last couple of weeks, we have seen our cases rise to over 1,000 a day. And that also means that as cases rise, then certainly hospitalizations and even death, unfortunately, will come not far behind. And so we really cannot take our foot off of the gas. We really have to make sure that those who remain unvaccinated get vaccinated, get their first dose. And as you have seen and heard both from our mayor and from our commissioner, the city's doctor, talk about the importance of New Yorkers now taking their own risks and understanding whether they should go ahead and get a booster dose. We want to make sure that individuals know that we have to do all the things that are going to keep us safe. And that includes making sure that our children who 5 to 11 are now eligible since November 3rd, because as you heard from the assembly member, certainly we want to protect each and every individual. And in order to do that, we have to take the responsibility of getting vaccinated so we can also protect everyone else, right? Those who are vaccinated, those who remain unvaccinated, and those who are ineligible to be vaccinated. I have a almost 2-year-old daughter, and she is not eligible. And so it is my responsibility and those around her to keep her safe. And certainly those who can get vaccinated are doing just that. And so that's the upshot. We're not out of the woods yet. We all have a part to play in keeping everyone safe. The vaccines will do that. Certainly making sure as we go into the holidays, all of our testing infrastructure continues to remain in New York City. All of our brick and mortar sites, all of our mobile sites, even we have at home kits are available, as well as the rapid test, which is the antigen test, and you get your results in 15 minutes for the rapid antigen test. And you get for the PCR test, you can get your results in 24 hours if you go into one of our DOHM8 sites or HN8 sites. And of course, masking, all the things that we've been doing for over a year. And so the resiliency of New Yorkers is always present and is palpable. And so I think this conversation is really important. So the matter at hand, 5 to 11-year-olds are eligible. There's only one vaccine that they can get, and that is the Pfizer vaccine. The Pfizer vaccine has been approved by both FDA and CDC. It does have emergency use authorization. There is a two-dose series. So the primary series still requires that the individual gets vaccinated a second time. And then 2 weeks after, they're fully vaccinated. So with the Pfizer vaccine, you'll take your first dose. 3 weeks later, you'll take your child back for their second dose. And so it's really important that they get both doses to be fully vaccinated. We're really making sure we're leveraging our entire infrastructure. And so we've learned in the beginning when we were just vaccinating healthcare workers and our elderly, as we expanded to underlying chronic conditions, as we expanded to other adults, and also to 12 to 17-year-olds. There is so much that we have learned, and we have a really robust infrastructure. And so that includes our city-run sites, many of our healthcare system partners, and we're going to hear from one of the pediatricians, and we're really working with our pediatric practices so that we can get more doses to them as well. But we're also happy to say that we've been working with our schools. And yes, we rolled out at many of our DOE schools, making sure that we had mobile sites, mobile vaccines available. And we are going to be working with our charter schools to do the very same, because this is how important it is that we get the vaccines out, working not only with our public schools, but also with our non-public schools to offer vaccines and make them available for children. What is really important is distinction from our adolescents. Consent is really important. And so it is important that if anyone 5 to 11 must have an adult with them when they're getting vaccinated. Now, that person does not have to be the actual caregiver or their parent, but the consent, either verbal or written, is required from the parent or caregiver of that child, even though an adult, someone else other than their parent or caregiver, can accompany them to the site. But there must be an adult on site for a 5 to 11-year-old to get vaccinated. So we want to make that really, really clear. We are doing all the other things that we've been, making sure that we know minimizes barriers. So equity has to be front and center. We're still looking at the neighborhoods that have been hardest hit and making sure we're marshaling our resources in those neighborhoods. We're also making sure that we're keeping boots on the ground, people knocking on doors, going to schools, supporting PTA meetings, talking about the importance of getting vaccinated. We've also built in to some of our workforce protections to make sure that city workforce members, other workers can have the time off to take their child to get vaccinated. And so we're going to continue to do more of that. And that gets to accessibility. And as I've already mentioned, sort of our mobile sites are really important. But then around the incentives, we did not wait. And we have actually expanded our incentives for 5 to 11-year-olds going with their adult to also, they can also receive $100 incentive as well. We know all of these things are going to be important in the effort and the mission of getting vaccinated, but the ultimate mission is saving lives. And that's what we really have to focus on. And again, we're just not out of the woods. So I look forward to the questions that will come up. And I think this is a really important conversation.
Thank you so much for sharing that pertinent information, Dr. Easterling. My name is Mariela Mesa Armenta, and I'm the Director of Advocacy and External Affairs at KIPP NYC Public Schools. I'm just going to make a quick announcement to remind our Spanish-speaking attendees that they can have access to translation, and then I'll transition into our next speaker. So, buenas noches a todos los que hablan en español. Si llegaron algunos minutos tarde, por favor, sepan que tenemos servicios de traducción en español. Si van al menú de la ventana de Zoom, hay un globito que dice Interpretation. Si hacen clic en ese globito, aparece la opción de inglés o español y pueden hacer clic en la parte de español y la traductora va a poder hablar con ustedes. Si no ven el globito de español, hay también una opción que tiene 3 puntitos para más opciones y la opción de traducción para español debe aparecer ahí. También pusimos un recordatorio en el chat que pueden leer con más calma. So we're really excited to have Dr. Wilson, who's the Medical Director of Community Pediatrics and Wellness and the Medical Director of Rochester Regional Health School-Based Health Centers, join us tonight. And we'd love to have you talk for the next 5 minutes about specific dosages, right? We've heard that children between the ages of 5 and 11 receive a specific dosage versus those who are ages 11 and up. And then also start talking a little bit about possible side effects that one can expect to see if their child 5 through 11 gets the vaccine.
Good evening, everyone. Thank you so much for the New York Charter Schools Association for the invite. We always love, Upstate always loves to participate in events like this. For the first question, the Pfizer COVID vaccine for ages 5 to 11 is slightly different in the dose compared to the Pfizer dose for 12 and up. For 5 to 11, it's 1/3 of the dose for 12 and up. To be exact, for 5 to 11, it's 10 micrograms compared to 30 micrograms for the 12 and up. Why is there a reduction in this dose? With phase 1 trials, we study a variety of doses to determine the lowest dose to give that would give us the appropriate, effective immunological response to provide protection. It's very important to understand that this dosing is not based on weight, like that we see with antibiotics and other medications. Those medications have to reach a certain therapeutic concentration in the body in order to be effective. Vaccines work at a different level. They work at the level of our lymph nodes to fight off infections. So the first dose, as I mentioned, is 10 micrograms, and then you will receive the second dose within 21 days, which will be an additional 10 micrograms. So what are some of the common side effects that you see? Actually, the side effects are very similar to what we were seeing with the Pfizer dose for 12 and up, except they might be a little bit more milder or no side effects at all. So side effects can include pain, swelling, or redness at the injection site, fever, fatigue, headaches, chills, muscle aches, joint aches, diarrhea, or vomiting. And typically, if someone experiences these type of side effects, they last about 36 to 48 hours and then resolve. Another side effect that parents are most concerned about, and they're reading a lot about, is myocarditis and pericarditis, which is the inflammation of the heart muscle or the sac that surrounds the heart. And these symptoms may present with chest pain, shortness of breath, palpitation, or your heart feeling like your heart is pounding. And it typically occurs 2 to 3 days after receiving the vaccine. The myocarditis is mainly a phenomenon that we were seeing in males ages 16 to 24. If you take a look at the data and you look at males that are 16 to 17 that were receiving their second dose, about 1 out of 5,000 actually experienced this mild myocarditis. And when you look at males from ages of 16 to 29, it's about 1 in 20,000. But it is less common in individuals that are in the age from 12 to 15, especially in the US and Israel when looking at their data. It's also very important to note that COVID infections are associated with myocarditis. The risk of myocarditis and pericarditis after receiving the COVID vaccine is actually quite lower than the risk associated with an actual COVID-19 infection. It's also important to note that many of these cases of this myocarditis were mild, self-limiting, and may have required over-the-counter pain medications such as Tylenol. Another question that a lot of parents will ask me is that they've seen out in the literature that there's, when you go to the VAERS website, which is the Vaccine Adverse Side Effects Reporting System, that there's a documentation of over 8,000 deaths associated with this vaccine. But let's actually look at what that system is actually reporting. So as a health provider, we are mandated to report any death of anyone who has received the vaccine, regardless if it was associated with the vaccine or not. It's also important to note that those who are reporting, it can be anyone reporting. It's just not health providers and officials. So anyone can report any incidents. So for example, if I received a vaccine and that day I stubbed my toe, I can actually report that I have a sore toe and I can say that it's associated with the vaccine, but there's no evidence that says that association of that sore toe is due to the vaccine. And that's me just kind of putting it simplistically. So to date, when you're the CDC states that there is no detection of any unusual or unexpected patterns of death following immunizations that indicate that the COVID vaccines are causing or contributing to death, outside of the 3 confirmed deaths following the J&J vaccine. So in essence, these vaccines are very safe. Thank you.
Thank you for that, Dr. Wilson. We very much appreciate it. Good evening, everyone. My name is Asia Worthy Davis, and I'm the Regional Senior Director for External Affairs here at Uncommon Schools. And I'm a former Health Department employee, so good to see some of my former colleagues here tonight. We very much appreciate that information you shared, Dr. Wilson. And now we'd like to get into a little bit of what parents should be paying attention to when looking at potential issues and steps they should take around the COVID-19 vaccine. Want to pass this to Dr. Lena Finland, emergency medical physician in Albany, for the next 5 minutes to talk a little bit about adverse reactions.
Thank you, sir, so much. And thank you also to the New York Charter School Association. Very much appreciate being here. And so nice to have this wonderful group of panelists here assembled to share some good scientific-based information. So adverse events with the COVID vaccine, Dr. Wilson has touched a good deal about on, as you heard, very similar to with the adults. You're going to get those local side effects after the vaccine: redness, swelling, pain at the injection site is the most common. And then the systemic side effects can happen after either dose: fatigue, headache, body aches, diarrhea, fevers, chills, vomiting. During the trial of the 5 to 11-year-olds, the most common adverse events in terms of the systemic ones were fatigue, which was 39%, and then headache, 28%. Most were mild or moderate. They resolved after 1 to 2 days. Less so the fevers and chills. We did not see as many in the little children, in the 5 to 11-year-olds, as the older adults, older children and adults. If your child has gotten the vaccine and they're experiencing some of the side effects, over-the-counter Tylenol, ibuprofen, appropriately dosed for their weight, are great ways to treat that if it's bothering them. Make sure they're drinking fluids. Touch base with the pediatrician if it's lasting more than a day or two, certainly. There are also, they've also seen lymphadenopathy, which is swelling of the lymph nodes, most commonly in the armpit, and rashes with the vaccine. There were no cases of myocarditis, which is the inflammation of the heart that Dr. Wilson had touched on, as well as anaphylaxis or deaths in the 5 to 11 clinical trials. Now, this is something that we will continue to watch and follow, because we actually wouldn't expect to see any of those events in this group of, there were a few thousand children. The reason for this is because overall, the frequency of those adverse events is very, very, very low. To give you an idea, anaphylaxis occurs in about 2 to 5 per million people that get the vaccine. So, a group of 3,000 children getting it, you would not expect to see an anaphylactic event. Myocarditis, again, Dr. Wilson mentioned, but around, on average, 1 to 20 of the vaccinated adolescents. So, and so, again, we had a much smaller group, so we would not expect to see this. And this is very important to understand, that there's no risk-free option. If you are saying you're not going to get the vaccine because you're concerned your child could get myocarditis, COVID is becoming endemic. Eventually, everyone will either get it or be vaccinated against it. And there's a much higher chance that your child could get myocarditis from the vaccine. It's actually 1 in 40, not 40,000, 1 in 40 vaccine, COVID virus induced myocarditis. So no risk-free option. It's just choosing what risk you want to take for you and your family and your children. The great thing about vaccine-induced myocarditis, if you can find a silver lining, is that kids are bouncing back very quickly from it. There was a study that looked at adolescents and they had fully recovered from their vaccine-induced myocarditis after 35 days. They have not been seeing the arrhythmias and the weakening of the heart that you can see with virus-induced myocarditis. So that's very important to note. And then the third adverse event that everybody has high on their mind as well, especially with little children, is death. And as Dr. Wilson mentioned, other than those few clot deaths due to TTS, a condition that has been plausibly associated with the Janssen, the J&J vaccine, there have been no deaths that have been causally linked to the COVID-19 vaccines. One thing I do want to mention is the myocarditis in the children has shown up after the second dose, most commonly around day 4, but anywhere from days 1 to 7. And things to look out for if your child is complaining of chest pain, shortness of breath, feeling like their heart's beating or fluttering quickly, that is something that certainly should be checked out right away and in an emergency department.
Great. I think, Michael, you're up.
Thank you, Dr. Finland, for all that very helpful information. My name is Michael Catlin, and I'm the Executive Director of the Coalition for Community Charter Schools. Next, we have the Associate Commissioner in New York State Department of Health Director, Office of Minority Health and Health Disparities Prevention, Mrs. Wilma Alvarado-Little. In about 5 minutes, can you share with us the updates, the statistics, and the facts that we are now seeing as far as getting our children vaccinated across the state, and then things that we can encourage our participants from the benefits of our youth being vaccinated?
Thank you very much, and thank you to all the fellow panelists. The information that is being shared is of such value to our community and to keep our children safe. So as of this afternoon during the governor's press conference, it has been reported that 244,000 children have received the vaccine across the state of New York. And so we are supporting all efforts across the state to ensure that there is an equitable distribution with the vaccine at all levels. One of the things that the Office of Minority Health and Health Disparities Prevention is doing is we are working with our faith-based communities to ensure that our communities are receiving the services and the resources that they need. So it's been truly an honor and a pleasure to work across our communities in this fashion and partnering with our faith-based brothers and sisters. And so there's, the questions and the conversations about should I, why should I, I'm hearing a lot. And one of the very positive and fortunate things that we're hearing here in this panel presentation is to distinguish between myth versus fact. And so, the question is, should I consider getting my child vaccinated? So we're looking at the 5 to 11 group, and just for clarification, Pfizer is it right now for them. So, if there's questions about which other vaccine, not just yet, we're working, Pfizer is the one that has been approved as the fellow panelists have mentioned. So what are some of the benefits? The vaccine prevents kids from getting COVID-19, it has a much higher possibility of that happening. Although COVID-19 in children is sometimes milder than adults, some of our kids are still getting infected, right? And so let's remember that, the current vaccines are still effective in preventing severe illness from the Delta variant of the virus. So we need to keep this in mind as we are thoughtful about our decisions regarding the vaccination. The vaccine also helps prevent or reduce the spread of COVID-19. So like adults, children also can transmit the virus to others if they're infected, even when they're asymptomatic. So we need to be mindful of that. And as Dr. Easterling had said before, it's our responsibility to keep those who are still vulnerable, those younger than 5, protected, right? That's part of our role as caretakers to our children. And then also it helps prevent or reduce the spread of that. So keeping this in mind also, and getting vaccinated for COVID-19 can help stop other variants from emerging. Not to say that it truly will, however, it increases the possibility that these other variants will appear. And then also too, the virus can transmit easily between unvaccinated children and adults, and that gives new variants a chance to emerge. It also helps our children restore a more normal life, right? So getting vaccinated will also help keep children in school and participating in things they enjoy. When they're exposed to the virus, and to those who are vaccinated are less likely to get infected, and so are more likely to be able to continue participating with less disruption. And it also helps protect the community. So this is another strong reason to consider, especially those of us who grow up in multi-aged households who are vulnerable. There may be others who are vulnerable from a health perspective within our households. So if we're looking at our youth and our elderly, we need to be mindful of our communities here. And so one thing I will do, I'll drop in the chat, we do have materials provided in the 10 main languages as identified by our most recent US Census, that are available in languages other than English. So I will drop the links in the chat for others to review later. And that includes our frequently asked questions about 5 to 11-year-olds in the COVID vaccine, and then the Vax to School campaign, and that's the COVID-19 vaccines for children and adolescents. And then the FAQs for answers to common questions about COVID-19, and also our New York State Back to School pop-up locations as well. Thank you.
Wilma, thank you so much for providing such helpful resources. And we will be sure to direct people to the chat so that they can access that and have follow-up readings as they continue to learn about the vaccines for kids 5 to 11. Now we're going to move on to some of the submitted questions. We do know that our registrants submitted questions ahead of time, and we also know that we've asked you to submit questions through the Q&A function, so please continue to do that as we continue to use this time to answer any follow-ups that you may have. Let's start with Dr. Easterling. Dr. Easterling, can you answer a question that we have about the booster? Is it going to be available for children ages 5 to 11? And if so, how soon after the first dose should they take it?
Yeah, this is a really important question, but at this time, we do not have the answer. I did include in the chat right now, all booster doses are for individuals 18 and older. And let me just underscore that this is how our system works. We look at the data and the science, and then our organizations are able to then provide clinical guidance about who should be eligible for a booster dose. As you've already heard, we do expect us moving into this endemic phase. And essentially, we expect that there will be some presence and transmission of the SARS-CoV-2, Delta virus, and other variants sort of circulating in our community. So the booster dose will give us the extra protection that boosts to our immunity and that additional protection. So we're going to have to wait for the science on and recommendations related to booster doses for children. But let me just also just make sure, just to reiterate the importance of getting your your first dose and following up and getting your second dose as well.
Thank you for that, Dr. Easterling. Dr. Wilson, I want to throw a question to you. Can you take 2 minutes and let us know, is the vaccine recommended for people with pre-existing issues like autoimmune disorders, maybe those who've had surgeries or have serious allergies to vaccines? What populations can or cannot get the vaccine?
That is a very good question. So it is recommended for individuals that have autoimmune disorders or conditions such like asthma and what have you. There's no contraindication for them to get vaccinated, except if they have allergies to the ingredients of the vaccine. The benefits of the COVID vaccine actually outweighs the potential of these side effects. If you have questions regarding your child's autoimmune disorder or other disorders or conditions that you feel that may prevent them or cause reactions to the COVID vaccine, that is when you meet with your pediatrician, family medicine doc, or a subspecialist that you are seeing. Some are concerned that their children may not mount a sufficient immune response. And we're seeing this in some of the adults that are requiring a third dose, and not a booster, a third dose. But right now, it is not recommended that children from age 5 to 17 receive a third dose. And so again, if you're concerned that your child is not mounting the appropriate response to the vaccine to fight off or prevent serious illness from COVID-19, this is where you would follow up with your pediatrician.
Thank you very much. Dr. Finland, can you answer the question, if my child turns 12 between their first and second dose, what should they get for their second dose? If you could just respond within 2 minutes.
Yep. So yeah, very good question. There'll be a number of kids kind of bridging that time. And the answer is for their first dose, when they're 11, they will get the 10 microgram dose. When they are 12, if they've turned 12 for their second dose, they're to get the 30 microgram dose. And that has to do with what Dr. Wilson had touched on earlier, that this is based on the immune system's maturity, not kind of a age or not a weight-based thing. So that's what will happen if, as long as you reported the birthday right, that's what should happen.
And I can hop in here, Ms. Alvarado, in 2 quick minutes. Can you answer why only the Pfizer vaccine is available to children ages 5 through 11?
Thank you. Not being a clinician, and I would also encourage those who are pediatricians on the panel to jump in. The testing is not complete. And so there are opportunities for testing, for clinical trials, and for review, and for the necessary approvals to be received. At the forefront of the distribution of the immunizations, it is to ensure that it is safe to administer to children. And so I will leave it there and encourage those in the medical field to add a little bit more.
Thank you for that. We actually crowdsourced questions from our community prior to the event via the registration. So we have a bunch of questions. I also noticed there are a bunch of Jacqueline Martells in the chat, and I can assure you that is not me. There seems to have been some technological glitch. So just wanted to put that forward. All the Jacqueline Martells are not me, but we're very happy to have you here, everyone here. So if you do put your name in the chat and you're listed as Jacqueline Martell, just put your name after your commentary question to distinguish who you are. So the question I will ask, and anyone can feel free to jump in, any of our experts. Will there be an option for children younger than 5 to receive the vaccination? And if a child is small for a 5-year-old, should they receive the vaccination that is for a 5 to 11-year-old? Same for the opposite. If a child is larger or larger than your typical 11-year-old, should they receive the vaccination for someone that is between the ages of 5 or 11?
I'll jump in. So I think there are a couple of questions here. The first question is around availability for the vaccine for children younger than 5. Did I get that right, Jacqueline? Okay. So the data is not available yet. As you've already heard from our previous panelists, there are manufacturers that are still testing, and they're still conducting their clinical trials. And so even for the Pfizer vaccine, there was a phase 1, 2, and 3, and they really looked at different age groups. Certainly the 6 months to 5-year-olds or 4-year-olds, I should say, was part of their clinical trials. And so there's more data that we expect, particularly for the Pfizer vaccine. Moderna has also conducted a clinical trial related for 5 to 11-year-olds. We expect that we're going to get more information. So I think this is what we want to do, is we want to wait for that science and data to be available before we have any recommendation or clinical guidance before anything comes out. Mm-hmm. And I don't remember the second question.
I think it was more so alluding, and this was a question from the community, was more so alluding to a child's size. Should that be, is that correlated to the dose or the vaccine that they get? So if they are, let's say, typically physiologically larger than your average of 5 to 11-year-old, would they get a dose for an adult? Or if they are smaller, would they get the dose relegated to their age, their size?
The answer for that is you get the dose that is your age. It is based on the age of your immune system, not on the weight of your body. And Dr. Wilson kind of touched on that when she spoke earlier. We give antibiotics based on weight because it has to go all over your body to find the infection. Your immune system is based in your lymph nodes, and it can kind of just respond very locally. So that's why it's based on age.
Thank you for that clarity.
Yeah, thank you both for that. I'm going to ask 2 short questions, and whoever wants to can answer them. The first question is around getting the flu vaccine and the COVID-19 vaccine. Is there an order in which that should happen? We're heading into flu season. Should we be concerned about both? Can they be both done at the same time? That's question number 1. And question number 2 is, do we know how many children were tested in the clinical trials for the vaccine?
So yes, you can co-administer both the flu vaccine and the COVID vaccine, so you can receive it same day. And if a parent chooses not to allow their child to receive on the same day, there is no time limit, and so you don't have to wait 28 days to get the other vaccine. So if you get your COVID vaccine, you can wait a week, you can wait 2 weeks, and you can get the other vaccine, your flu vaccine, shortly thereafter. So co-administration is allowed, and it's been very clear from our CDC guidance that this is possible.
And then for the second part of your question, I don't know if someone else can answer.
The second part was about how many children were participating in the clinical trials for the COVID-19 vaccine.
So for the clinical trials for ages 5 to 11, there was approximately 2,400 kids. 1,600 of those received the vaccine. 800 were placebo, which means they did not receive active vaccine. Mm-hmm. Of those 1,600 that were vaccinated, 3 were COVID positive. And out of those that did not receive the active vaccine, 16 of those were COVID positive, which shows us about a 2% infection rate if we extrapolate that data to the general population. This vaccine is shown to be 91% effective against symptomatic illness.
Thank you both so much.
We have another question, and feel free to jump in. When can a child get the vaccine after a positive test? And if they're asymptomatic, and someone said, my child has had COVID and tested positive for antibodies. Should they get tested again before getting the vaccine?
So after a child has tested positive, if they're asymptomatic and they don't develop symptoms, once they've cleared their isolation period, which is 10 days, then they can go get vaccinated. If a child is symptomatic, then they should have cleared their isolation period and be feeling better too. And then for the second part, I've forgotten it already.
That keeps happening. It's fine because you guys have so much information to give. It says, my child has had COVID and tested positive for antibodies. Should they get tested again before getting the vaccination?
So assuming they're off their isolation period and everything, they do not need to get antibody testing before getting the vaccine. The reason for this is, when you have vaccine-induced immunity, it's kind of a very predictable thing. When you have natural immunity from actually contracting the virus, it's not clear who's going to get a great natural immune response and who's not. If you, like in adults, they've shown that like people that are in the ICU and super sick, most of them have a really good immune response, but there's actually a few that don't, that their antibodies don't really last that long. So you can't really base your child's kind of illness or, the antibodies that you're testing on the antibody test, because we don't know how long they're lasting, and they actually aren't the same antibody. The antibody tests aren't often testing the spike protein, which is a different antibody that we're using in the vaccines.
Thank you for sharing that, Dr. Finland. We've been also looking at questions submitted by our Spanish-speaking community members, and one that I've seen quite a bit on here is if any one of you could speak to any negative effects of the vaccine that have been reported for girls in their development stages. I think a lot of the questions that have come in the Spanish language questions really have questions about the future and how getting the vaccine from ages 5 to 11 can impact a child's development.
I can jump on that again if you want. Would you prefer I answer in English or Spanish?
So I think English is fine, and then we have our translator who will share that in the other room.
Okay. So this is a completely understandable worry that parents have. I have a 6 and a 4-year-old girl. I get that. My 6-year-old has gotten her first shot already. There's no biologic plausibility that this vaccine should cause problems in fertility in young girls or women. Anecdotally, we have had tons of women get the vaccine and become pregnant after as well. It is a common fear that is spread for many vaccines, fertility issues. There's actually countries in this world that still have polio issues because that population is scared that the polio vaccine is going to cause fertility issues. So this is a very common, close to the heart concern that women, families, parents all have. It's understandable to have, but it's important to understand that there's no biologic plausibility that the vaccine can cause this.
I guess I'll jump in here. Is there COVID vaccine 19 safe for children with autism? And has there been any studies done on children who have developmental disabilities? And that's for anyone.
There have been no studies that are looking particularly at autism or disabilities, developmental disabilities in children to see if vaccines have any impact. For those who are autistic and have developmental disabilities, We are still vaccinating against the flu, measles, mumps, varicella, and there are no risks associated with those particular vaccines. As same with as far as what we know for right now with COVID vaccine.
There's another question here from our community. Should we build children's immune system before they take the vaccine? How much risk do unvaccinated children, adults pose to the school community? And is the vaccination mandatory, and will it be to attend school? Now, I know that is a loaded question. Some of you have already answered some of that. So feel free to pull what you feel is important. And on the policy side, Assemblymember Zinnerman, if you want to jump in as well, or Dr. Easterling, feel free to do so.
I'm sorry, I missed the question.
Sure. So should we build, there's multiple questions. I'll break it down. Should we build children's immune systems before they take the vaccine? And how much risk do unvaccinated children, adults pose to the school community? That's the first question. And then the second question is the vaccination mandatory to attend school?
Got it. Okay. So I'll start in the reverse. So the vaccine requirement is in place for school staff, principals, teachers, and then for students who participate in high risk activities, and specifically for high school students. So you're talking about things like basketball, football, some of the winter sports. And so, those are the vaccine requirements that are in place. There are no vaccine requirements for children to attend school. And then to the first question, the reality is that this is a new coronavirus. It was a novel coronavirus, something that we have not seen before. And so our immunity was nascent. And so we need the protection that the vaccines offer in order to give us the protection against SARS-CoV-2 or any of its variants. And so, that's why really understanding how vaccines work, really the ways in which these vaccines offer protection is important. And I did not mention this earlier, but I do want to just make sure that parents do know, obviously we're answering questions on this town hall, but if there are additional questions, we do have a nurse hotline through our test and trace infrastructure. So 212 COVID-19, 212 COVID-19. You can call and get your questions answered directly if you have more questions that you want to follow up on.
Thank you for that, Dr. Easterling. Assemblywoman Zinnerman, I saw you had unmuted yourself there for a minute, so I want to give you the chance to have the floor.
I think that was an excellent answer that Dr. Easterling gave to us. I just want to say that we know that this is a ever-evolving pandemic that we're dealing with, and again, to underscore that we have every expert that we know working on the efficacy of the drug usage across the different age groups. Constant monitoring is going on, and this is something that we have absolute evidence that is working toward reducing the COVID outbreaks. And I think that you've heard from some really great experts this evening that explain to you where we are and why this is the pathway that we need to all be involved with. Again, I know it is very, very scary when something is new. But I think, folks have mentioned, this vaccination didn't come out of anywhere, was based in the SARS that had been tested and tested. So they were able to really use that as a basis for how we were going to address COVID-19. And as policy changes, the governor will be giving briefings. We will have that information and share as well. And we'll just continue to talk to our neighbors and our friends and the larger community about why we're all in this together. And our only goal is to keep everybody safe.
Thank you so much, Assemblywoman Zinnerman. We greatly appreciate that. We have so many questions and remarks. I can see that this is a continued conversation that we'll have, and this is the third installment of vaccine forum that we've had. And we're very grateful for everyone that could join and then provided questions both beforehand and also in the chat. We're going to do our best to go through these questions and figure out a mechanism to provide further answers. But as Dr. Easterling said, there are other resources that you all can utilize to help get answers to your questions. I'm going to turn it over to each panelist for about a minute just to give some closing remarks before we end this webinar. I know you have to hop, Dr. Easterling, so I'm going to turn it over to you for any last remarks that you may have.
Yeah, I just wanted to say thank you again to the New York Charter Schools Association for hosting this important conversation. We have to do everything that we can to support our communities, to support our children. So I think it's really important that we do all we can as government officials and healthcare providers and public agencies to get the word out where you can get vaccinated, how these vaccines are really important and, really supported with access. And so I do hope that this information doesn't stay here. Share your stories with others who are not with us this evening so that they can also receive this information. Thank you.
Thank you so much. And we will also be sharing this. We have recorded this webinar and we'll be sharing it out as well. Dr. Easterling, can you just give the phone number for the hotline that you referenced one more time for people who have any questions?
Sure. That number is 212-COVID-19, 212-COVID-19. And I think Mrs. Alvarado Little has also provided the number for the state's line as well. And so all the resources, we just want to make sure you know that you have information available.
Thank you so much. Assemblywoman Zinnerman, I'll turn it over to you for any closing remarks you may have.
I just want to really want to take this time to again thank the New York Charter Association for always being on the cutting edge conversations, making sure that you provide a platform for students and parents and families to discuss the issues that impact our everyday lives. This is very important. It doesn't happen in a lot of places where people feel like their voice is heard and that they can and that they could speak up, that there's a space that's for them to speak up, regardless of the fact that we may not agree. You guys don't shy away from that. But I just want to echo the sentiments of the night. We keep each other safe. So if we could think about our neighbors, our friends, our children, and those who are most vulnerable when we make our decisions, I think that we understand that this is a time that we come together for vaccines if, again, you are eligible to take it. Thank you and have a great night, everyone.
Thank you so much, Assemblywoman Zinnerman. Dr. Finlan, I will give you the floor.
Thank you. Thank you again, New York Charter School Association, for having us this evening, for bringing us together to share this information. I think what I want to leave everyone with is, there's a lot of discussion, a lot of concerns going on. I think the most important thing that someone can do is have a discussion with your trusted pediatrician, sure that whatever you're gathering your information from is a trusted source. Healthychildren.org is one example. And, just take everything that you hear from, I have a sister that's cousin did this with a grain of salt. There's a lot of science that's gone into creating these vaccines and to evaluating them for their safety. The pattern that has happened with the adults first, then move to the adolescents and then to the younger children is typical of vaccine development. And everything is kind of going along as it traditionally does. It just seems faster because we've had a lot of money poured into this, but they've taken all the necessary safety steps, the phase 1, 2, 3 trials. And I encourage you to trust the science. Thank you.
Thank you so much, Dr. Finlan. And last but not least, Ms. Alvarado Little, I will turn it over to you for any closing remarks.
Sure, thank you very much. You know, I echo, and again, thank you very much for New York State Charter Association for including us here, or I'm sorry, New York Charter School Association for including us here. And I agree, you know, this is a topic that is very important to all of us. And we don't have to be a parent or a caretaker, you know, when it comes to our children. We want to know what we want to know. And getting that information is extremely important. Looking at trusted resources, you know, we can also look at the web pages for the American Academy of Pediatrics. We can talk to our healthcare providers, our federally qualified health centers as well. And making sure that when we ask our questions, because those questions are important, that the correct information and the clear information is provided, not because, you know, oh, I heard it from someone who said that they heard it from blah, 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 right? So getting that information that's clear and can be supported is really key, because I think at the end of the day, we're all trying to keep each other safe. And what better way to do that than keep the lines of communication open? Thank you.
Thank you so much, Ms. Alvarado Little. Again, I want to thank everyone who joined us this evening. Thank you to all of our panelists and experts, as well as our Assembly Member Zinnerman. I want to thank my colleagues at Democracy Prep, C3S, KIPP New York Schools, and of course the New York Charter Schools Association, and all of my Achievement First family, and everyone else who came this evening to provide, to have a listening ear, to partake in virtual conversation. This is not the last of these conversations that we will be having. We intend to have further conversations around this topic and other topics at large. As I mentioned, we will be providing the recording to all registrants shortly after this event, so be on the lookout for that. Again, we want to thank you all for being here and have a great evening.
Good night, folks. Thank you very much.
Good night. Buenas noches.
Oh, now I'm open. I was frozen the whole time, y'all. Thank you everyone for coming this evening. I just got unfrozen.
Oh, wow.
Yeah, I was frozen. I couldn't do anything.
Oh my God.
But thank you, Evelyn. You could tell everybody good night on the Spanish line. And thank you, Ms. Alvarado. Good night, everyone.